Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative, down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Gwenevere White, and she's the Vice President of the Arkansas chapter of the American Academy of Pediatrics. Dr. White, thank you so much for joining us again.
Thank you for having me again. It's a pleasure to be here.
So can you start by telling us about your role with the Arkansas Academy of Pediatrics and your work around childhood immunizations?
So I serve as the Vice President of the Arkansas chapter of the American Academy of Pediatrics. And within that role, our organization really endeavors to be the voice of pediatricians. And so our board, in particular, executive director, really works from a legislative standpoint towards advocacy. We work at both the national, state, regional level, and at the local level to make sure that pediatrics the needs of pediatricians are being not only vocalized, but also addressed.
And we're hearing more about whooping cough outbreaks. For those who may not be familiar, can you explain what whooping cough is and why is it still a concern today?
Absolutely. So whooping cough or pertussis is a vaccine-preventable respiratory disease. Basically, it's caused by a bacteria called Bordetella pertussis. And people with whooping cough or pertussis basically will start off with just runny nose, coughing, that type of thing. But over time, that coughing progresses into severe coughing fits. And so they can go 2, 3, 4 minutes and just cough, 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 cough. At the end of that, because of the prolonged coughing, they can kind of take a deep breath and that noise is why it's called whooping cough. For children, in particular in babies, it can be very, very dangerous because they don't have the respiratory reserve that adults have. And so as a result, when they get into these bad coughing fits, they can actually stop breathing.
And how common is it in Arkansas right now? Are we seeing increases similar to what's happening in other states?
We are. So according to the Arkansas Department of Public Health, right now we have about 447 cases that have been diagnosed this year. To put that into perspective, between 2010 and 2023, there were an average of about 130 cases per year if you exclude our last major outbreak, which was in 2013. In 2013, we had about 464 cases in 1 year. And so we had a bad outbreak then, and we are well on track right now to surpass those numbers.
So what are the early signs and symptoms of whooping cough that providers and even parents should look for?
So, as I said earlier, it kind of starts off just like a regular common cold. The big differentiating factor is what we call paroxysmal cough. And so that's where they cough, 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 and then have that big breathing episode afterwards. These fits they're just out of nowhere. They're sudden. They can be very violent. It can cause people to actually have vomiting afterwards. It can be such a strong coughing fit. And so if you start to see that, where it's just out of nowhere, you have these bad coughing fits that can last seconds to minutes at a time, that should be a key sign.
And can you talk about how easily it spreads? I mean, it's very contagious.
Yes, it is very contagious. And a lot of times people may be infected for 2 to 3 weeks before they actually start to show symptoms. And so it's important to make sure that we're vaccinated to help prevent that.
And you touched on this a little bit. So it's so important for even mild cases in older children and adults to be identified because it's so dangerous for babies.
Yes, absolutely. So, with just like with almost any illness, people that are young adults and that type of thing are typically very well protected from these illnesses. But the kids that are most at risk are the kids that are under the age of 1. On average, about 1 in 3 of those kids will actually require hospitalization. And about 65 to 70% of those kids, especially if they're under the age of 1 month of age, will actually have episodes where they stop breathing. And so it is very, very, very dangerous in the newborn population in particular. About 1 in 5 babies that get it will end up with some type of pneumonia. About 1 in 50 babies can end up with seizures, and about 1 in 150 babies can end up with encephalopathy, which is a bad disease of the brain, which causes a lot of long-term consequences. And so all of that to say, even though in older children and adults, we are well protected and we don't have that severe illness, we have to protect our young people.
And which vaccines protect against whooping cough, and what ages are they recommended?
So the vaccines that we use to protect are actually a combination vaccine. So in younger kids, it's the DTAP. It's a combination vaccine that protects against diphtheria, which is a bacterial infection that causes swelling and inflammation of mucous membranes that can lead to breathing difficulties, swallowing difficulties. It can also release a toxin that can cause heart failure and paralysis. It protects against tetanus. Tetanus is a bacterial infection that causes severe muscle spasms and stiffness. It used to be referred to as lockjaw, where you can't move, you can't drink, you can't eat, all of those things. And then, of course, the pertussis vaccine. And so this combination DTAP is given at 2 months of age, 4 months, 6 months, and then a booster dose is given between 15 and 18 months of age, and then at 4 to 6 months of age. From there, kids will usually receive a Tdap vaccine, which comes usually in that 11 to 12-year-old age range, and that's a booster to the DTaP. And then after that, it's recommended that you receive a Tdap vaccine every 10 years to help boost that immunity. And then for pregnant women, we do recommend that you receive a Tdap every pregnancy. And that just allows for some protection, some antibody protection to the newborn baby for the first kind of couple of months until they can get that DTaP vaccine at 2 months of age.
And we sometimes see gaps in vaccine coverage between childhood and adulthood. What can healthcare providers do to close those gaps?
So the biggest thing that they can do is try to discuss vaccines at every point of contact. I think that the biggest problem that we see is that frequently you don't go to the doctor once you get older. You don't have those annual wellness visits. And so most of the time, if you're going, you're ill or there's a specific purpose. And so as providers, it's important that anytime we have contact with patients to make sure that their vaccine status is up to date. And if it's not, to recommend that they go ahead and get immunized.
And it's important for them to work across specialties. Is that pediatrics, OBGYN, family medicine, and public health?
Absolutely. All of us have to work together. So in pediatrics, obviously, we have our normal vaccine schedule. Our OB-GYN colleagues can really push to get that Tdap during pregnancy. And then obviously the family practice, anyone that's interacting with children or adults can encourage those folks to get vaccinated at whatever point they are in their season.
And vaccine confidence is essential. What are some successful ways that you've seen providers talk with hesitant patients, even caregivers, about that whooping cough vaccine?
So the most important thing is to meet people where they are. I always try to start off the conversation with, what are you concerned about? What are you worried about? From there, try to be empathetic and build a bridge. And so really discuss the necessity of it and discuss what it looks like, especially in these younger kids. And once you do that, establish that relationship and kind of build that trust, a lot of times it becomes more easy to help guide them down that path.
And how can community partners like schools, child care centers, even faith-based groups help reinforce the importance of staying vaccinated?
I think that across the board, it's just important to make sure that we are being consistent with our messaging. And so the science is clear. The messaging should be very clear as well. These are safe, they've been studied, they are effective, and that's how we protect our community.
So on a final note, as for families, a healthcare community that's watching today, where can they go to find reliable information about whooping cough and immunizations?
So I recommend going to either aap.org or healthychildren.org. Those are two websites that are run by the American Academy of Pediatrics. They've been vetted. The material there is great for both healthcare professionals as well as the everyday person. And so it's great information. It's easily accessible. It's easy to understand.
Well, Dr. White, thank you so much for being here again and talking about this important information. I appreciate you.
Thank you for having me. I hope you have a great day.
You too. And that's it for this episode of AFMC TV. Thanks for watching and have a great day.